this is in picogram. So the cell, if it is having this much value, the cell will become normochromic. अगर इस रेंज के अंदर हीमोग्लोबिन कंसेंट ये वैल्यू आ रही है MCH की, तो सेल क्या है? नॉर्मोक्रोमिक. If it is below then it is hypochromic. Yeah. Now, in what different types of anemias these terms will come into regular use. So the concept should be clear कि अपन माइक्रो, मैक्रो, हाइपो, नॉर्मो इसको क्यों बोल रहे हैं और किस बेसिस पे बोल रहे हैं. Clear? This is another important index, mean cell hemoglobin concentration or mean corpuscular hemoglobin concentration. In this, it is only the utilization of hemoglobin and PCV. Clear? The normal value is in 35 plus minus 3. The cell can never be hyperchromic. It may be normo or hypochromic, but it will never be hyperchromic. Last is color index. What do you mean by color index? Is percentage of hemoglobin and percentage of RBC. So if you remember in Kali's method, the hemoglobinometer tube has two scales, gram percentage and percentage. Okay. So whatever the value was there of, just इसने कहा 10 gram percent था, so 10 gram percent is equivalent to how much percent? The tube is having both the scale, so you have to read both the scale. The lower meniscus you have to read, gram percent की भी पढ़नी है और percentage की भी पढ़नी है. Okay, so ideally in some hemoglobinometer tube, 16 gram percent is equivalent to 100%. Okay, 5 million cells per cubic millimeter is considered as 100%. So if the person is having 16 hemoglobin, okay, per deciliter and RBC count is 5 million. Yeah, so the value will come 1. So ideally the value of color index has to be 1, but the range is between 0.85 to 1.15. Clear? These are the important parameters which will help us to give the morphological classification of anemia. The question is very lengthy, very interesting. Either you might get a long question, okay, long essay type question, or you may get a problem based question. But the question definitely will come. Okay, यूनिवर्सिटी एग्जाम तक आ सकता है, सेमेस्टर में पक्का आएगा. Okay, mean corpuscular volume. Okay, this is the formula. Mean corpuscular hemoglobin, another formula. MCHC, this is another formula. Okay, so on basis of these formula, we come and study the morphological classification, or another name for this classification is Winthrop classification. So the question may ask, add a note on Winthrop classification. Okay, add a note on Winthrop classification. So Winthrop classification में हमें क्या पढ़ना है या क्या लिखना है? Morphological classification of anemia. To understand or to have a knowledge regarding the morphology, we need to have the idea of the different RBC indices formula and their ranges. On the basis of MCV, MCH, MCHC, we can have to identify the different scenarios in which the cell can be normocytic, macrocytic, microcytic, hypochromic or normochromic. Clear? अब एनीमिया को रिकॉल करने से पहले 5 मिनट के अंदर हम रिकॉल करते हैं कि अपन ने जो अभी तक आरबीसी की स्टोरी पढ़ी थी. Okay, for erythropoiesis to take place, what all things are required or must? What hormones are must? Thyroid hormone is a must, first and foremost. Okay, another important is erythropoiesis. Okay, other than the hormones, we require the dietary factors. So what were the dietary factors? Iron, protein, carbohydrates, okay, for tetrapyrrole structure. So these are what the requirement for erythropoiesis. Okay, other than this, what all things are required for erythropoiesis is no problem in the congenital or genital defects. So congenital or genital defects may be spherocytosis, thalassemia, okay. So that might affect the production or the formation of RBC. Clear? Other than this, the average lifespan has to be complete. So if there is any sort of hemolysis, okay, or if there is any sort of problem in bone marrow, okay, bone marrow is the main site where the erythropoiesis or hemopoiesis is taking place. क्लियर? इस कॉन्सेप्ट को याद रखते हुए हम इसका स्टडी या क्लासिफिकेशन करें. Okay, now on the basis of this, this is normocytic and normochromic. In what scenarios, okay, if the patient is coming and in the history or the peripheral blood study, we come to know that the cells are typically normocytic and normochromic. Okay, in a problem-based learning, you get a question in which it is written that the cells appears to be normocytic and normochromic. So what can be the scenario? It can be acute hemorrhagic condition. The hemorrhage is blood loss. Now this blood loss can be acute or maybe chronic. But when it is given scenario like normocytic and normochromic, it is specifically acute, sudden. So when there is any acute blood loss condition, okay, the main component of the blood is plasma and formed element. So within 1 to 3 days, the plasma constituent will be restored, but the formed elements will be constituent within 1 to 2 weeks. It will take time. So there is no problem in the formation. Okay, it is only the sudden loss, maybe due to injury, trauma. Okay, so that is the reason in which there is an acute blood loss. So that will be restored within particular time frame. So there is no problem in the morphology of the cells. So cells will be normocytic and normochromic. Clear? So by acute hemorrhagic condition, it will be normocytic and normochromic. Hemolytic anemia is breakdown of RBC. Okay, so in case of physiological jaundice, neonatal jaundice or newborn jaundice, clinical picture will be normochromic and normocytic. Clear? Physiological jaundice किस वजह से हो रहा था? Excess of destruction of RBC. Hemolytic, this is breakdown of RBCs. Breakdown of RBCs के अंदर there is no problem in the formation. No factor is getting affected. Either there will be no problem in the thyroid, erythropoietin, iron, proteins, globins. So the cell morphology remains normocytic and normochromic. So when the classification is asked, you have to make this particular type of table and elaborate it, because the question is add a note on it. Clear? So you have to explain. If it is acute, then there will be no problem in iron absorption, there will be no problem in the formation, so the picture comes out to be normocytic and normochromic. So explanation has to be there. This is just a class of 1 hour, so I'll just try to cover particular points. Okay. Another is normocytic and hypochromic. Okay, the cells are normocytic, that the volume is normal, but it is hypochromic. So the cause is chronic hemorrhagic condition. Chronic hemorrhagic condition is when the person is having some sort of peptic ulcer. Okay, bleeding disorders, GI bleeding disorders. Okay, excess blood loss during the menstrual cycle, excess blood loss to the menopause phase. Okay, so these are the phases in which the loss is taking place continuously and for a longer duration, chronic. In that case scenario, the iron or the diet which a person is taking is not being able to getting reabsorbed. Okay, because continuously the blood loss is taking place. The time frame has to be there for the formation. okay, and for proper formation time frame absorption has to be there. पर वो क्या हो रहा है, कंटिन्यूस लॉस हो रहा है. तो इसके अंदर क्या हो रहा है, जो इरिथ्रोपोइसिस की स्टेजेस है वो तो सही चल रही है, ठीक है, सेल साइज अपना सही जा रहा है क्योंकि सारे बाकी इसके फैक्टर्स जो है वो सही है, बट ओनली इज द कंटिन्यूस लॉस ऑफ ब्लड. So whatever the thing has to be reabsorbed, okay, especially the iron, it is not being getting reabsorbed, the ferritin level comes down, okay, total iron binding capacity increases. So when the separate story, अगर problem based learning में आ गया आपके कि ferritin level कम हो रहा है, ठीक है, PIBC बढ़ रहा है, then it is hypochromic और iron deficient anemia. ठीक है, आयरन डेफिशिएंसी तक क्यों पहुंच रहे हैं, क्योंकि क्रोनिक ब्लड लॉस है. अभी हम किसके बेसिस पे क्लासिफिकेशन कर रहे हैं इसको, मॉर्फोलॉजिकल बेसिस पे. ओके, तो नॉर्मोसाइटिक नॉर्मोक्रोमिक का क्या एग्जांपल हो गया, एक्यूट हेमरेजिक कंडीशंस और हीमोलिटिक एंड एप्लास्टिक एनीमिया. व्हाट इज एप्लास्टिक एनीमिया, व्हेन द बोन मैरो इज नॉट एबल टू फंक्शन प्रॉपर्ली. ए मीन्स एब्सेंस. Okay, so there is not a proper formation of erythropoiesis or erythroid series, aplastic. So this is an example of this type of anemia. Another is macrocytic and normochromic. Macrocytic और normochromic picture कौन से में मिलेगी, megaloblastic type of anemia. इसको correlate कैसे करेंगे अपन, cause के साथ में जाएंगे, etiological classification. So etiological classification of megaloblastic type of anemia is deficiency of vitamin B12, folate. Okay, in that particular deficiency what will happen, अगर इन दो चीजों की deficiency है तो DNA formation proper नहीं हो रहा है. DNA formation proper नहीं हो रहा है तो we are calling it as megaloblastic. Blast means any nucleated cell of the erythroid series. If a particular RBC has to get a properly mature, the nucleus has to be extruded, removed from the cell. Okay, so if there is no proper DNA formation, no proper division of nucleus, the nucleus still present in the cell, and this type of cell is present in your peripheral blood smear that can be seen under microscope. So this is megaloblastic type of anemia. तो megaloblastic या सेल साइज बड़ा हो गया तो it becomes macrocytic. Megalo means bigger, cell volume has increased. So according to morphological classification, example of macrocytic and normochromic is megaloblastic type of anemia. When we study the causative reagent, causative, then it is the deficiency of B12 and folic acid. Macrocytic and hypochromic, inflammatory diseases, infection, okay, excess use of alcohol, etc. So they are going to affect the liver. When liver is getting affected, then what happens, there is problem in the utilization of iron. Okay, ferritin, transferrin, total iron binding capacity, they are getting formed and released from the liver. Liver का बहुत important role होता है iron storage में, stored as hemosiderin. Okay, so if there is problem in this particular case, then it is going to affect the hemoglobin concentration. So cell क्या बन जाएगा अपना, hypochromic. Okay, microcytic and normochromic, chronic infections. Okay, ये जो टेबल है ना, ये टिप्स पे होनी चाहिए अगर आपको 10 या 15 मार्क्स लेने हैं अपने प्रॉब्लम बेस्ड लर्निंग से. ठीक है, माइक्रोसाइटिक एंड हाइपोक्रोमिक, आयरन डेफिशिएंसी एंड थैलेसीमिया. क्रोनिक हेमरेज में क्या हो रहा है, नॉर्मोसाइटिक और हाइपोक्रोमिक, माइक्रोसाइटिक एंड हाइपोक्रोमिक एंड आयरन डेफिशिएंसी एंड थैलेसीमिया. इस पूरी टेबल के ऊपर कम से कम 6 MCQ हैं. Clear? You have at least 6 MCQs and you have a 5-mark question on this particular PPT. If your concepts are clear with examples. Without example, the things will not be clear. So you have to add a note, give the particular example of anemia or the morphological classification of anemia. At least 2 examples are being asked, okay, और इसके बेसिस पे अपना MCQ पैटर्न क्वेश्चन है. Etiological classification, okay, hemorrhagic anemia, megaloblastic anemia, hemolytic anemia, aplastic anemia and iron deficiency anemia. इन सब पे आप लोगों की किस्मत है, पर हर एक पे कम से कम 5-5 नंबर का क्वेश्चन आ जाता है, ठीक है. That is, you can add a note on morphological classification, you can add a note on megaloblastic anemia, iron deficiency anemia and hemorrhagic anemia. कोई प्रॉब्लम नहीं? आपस में डिस्कशन की आवाजें आ रही हैं इसलिए. Okay, accelerated blood loss may be acute, chronic or increased demand when the body is getting increased is infancy, pregnancy, menstruation, lactation, etc. Chronic blood loss may be due to through esophagus, stomach, okay, ulcerative conditions, small bowel syndrome, colon or through piles or any other disorders. Okay, these are the conditions in which there is chronic blood loss. Hemorrhagic anemia due to acute or chronic loss of blood, acute due to hemorrhage. Plasma is replaced in 1 to 3 days. So when there is some duration, value, particular emphasis has been given, please focus on this as that might come into your MCQ pattern. किसी भी टॉपिक में अगर आपको ये दिखता है ना PPTs पे या कहीं पे, तो you should go and mark it in your book. Okay. Scenario is when we are talking morphologically, normocytic and normochromic. तो normocytic normochromic का example क्या हो गया? Acute hemorrhagic condition. Chronic microcytic hypochromic anemia. Okay. Low levels of hemoglobin in RBCs due to chronic blood loss resulting in low iron levels in newly produced RBCs. Megaloblastic anemia characterized by large RBCs which are fragile and easily destroyed. Common forms are due to the deficiency of cobalamin and folic acid deficiency. Now, what can be the reason of deficiency of vitamin B12? It can be due to the atrophy of gastric mucosa. If there is atrophy or congenital absence of this particular layer, then there is deficiency of the intrinsic factor. If the intrinsic factor is not there, it will not be able to carry vitamin B12 and it will not be absorbed. Another important reason is severe pancreatic deficiency leading to non-freeing of vitamin B12. As it has been taken into GIT, it has been getting binded with another protein. That protein has to be removed and again it has to bind with intrinsic factor. Okay? तो अगर ये स्टेप नहीं हुआ ना, पैनक्रियास का रोल क्या होता है? उसको डिसोसिएट करना. So if there is severe pancreatic deficiency, that may lead to the non-freeing of vitamin B12 from this particular binder protein. If it is not freely available, it will not be able to bind with the intrinsic factor. Another is severe disorder of small intestine, example malabsorption syndrome. You can take it in your diet, you might have intrinsic factor, everything is favorable, feasible, but still there is problem in its absorption. Okay? That results into megaloblastic type of anemia. And another important point is gastrectomy. So in your problem based question, it is always written, अगर आपका pernicious या इसका example आता है ना, तो ये जरूर लिखा हुआ होगा, the person has gone through gastrectomy. Last line होगी, but it will be there. Yeah? So these points you have to remember. They may write severe pancreatic deficiency. So this will show that the binders has not been dissociated and it will not be able to absorb vitamin B12. So these points have to be remembered. Okay? अभी तो लग रहा है कि मुझे सब आता है. अभी हर पीछे बैठा हुआ बच्चा ये सोच रहा होगा, this is very boring, ये मुझे आता है, ये सब पता है. बट व्हेन इट कम्स टू राइटिंग, अगर मैं नेक्स्ट वीक भी आपको इसके ऊपर टेस्ट दे दूँ ना, यू विल नॉट बी एबल टू राइट इट डाउन इन 2 पेजेस, बिकॉज एक तो अभी आपके पास बुक्स नहीं है, और कभी भी गूगल से मत करना आप आंसर। गूगल की लैंग्वेज हम लोगों को बहुत अच्छे से पता है कि आप जो क्लिक करते हो और जो गूगल आपको रिस्पॉन्ड करता है, बिकॉज व्हेन वी वर डूइंग द प्रैक्टिकल माइक्रोस्कोप का कर रहे थे ना, तो बच्चों ने लिखा नॉट एमबीबीएस बट बीबीएस, दे जस्ट गूगल व्हाट इज कंडेंसर, ओके, एंड दैट केम आउट टू बी कि आप गैस को जब कंडेंस कर देते हैं, दैट वाज द आंसर रिटन, क्योंकि उन्होंने उसको डायरेक्ट गूगल कर दिया व्हाट इज कंडेंसर, है ना। So don't create these type of blunders in your copies or anywhere. Please refer to your book, any book. Okay, this is the story. Cobalamin taking it, binding with the R cobalamin. Okay, it is coming, getting attached with the intrinsic factor, entering into the small intestine ileum where it has been taken, and transcobalamin, and finally this has been taken into tissue cell. This is blood. This is terminal ileum. This is the story. So when you get a question on add the note on pernicious anemia or megaloblastic type of anemia, if the number is of 5 marks, please go for this type of diagram. ठीक है, समझ आ रही है? हाँ या ना? ब्रेकफास्ट किया है? क्यों ब्रेकफास्ट क्यों नहीं किया? So this is pernicious anemia, impaired absorption of vitamin B12 because of lack. It is an autoimmune disease. Another MCQ is, it is an autoimmune disease. B12 is necessary for the formation of red blood cells. How it can be corrected? B12 supplements. Okay. How many of you support supplements? बताओ बताओ। ओके, विटामिन B12 सप्लीमेंट, ये सबसे आगे बोला। सप्लीमेंट्स आपने ले लिए, पर आपने किस तरह के सप्लीमेंट लिए? ओरली? यस? क्यों नहीं? अब गलत लग रहा है? तो क्यों गलत लग रहा है? Why? No, that is a separate story. वो अभी अपन डायग्नोसिस और उस पे नहीं पूछे, मैं ये पूछूं कि इसका कुछ ट्रीटमेंट है तो क्या है, इसको कैसे अपन फुलफिल कर सकते हैं कि if you comes to know that this is the anemia which is due to the deficiency of B12, so what is the scenario, what will you do? The first role of a doctor is to be patient को तो आपको सही करना है ना। Whatever may be the resources, that might be natural or orally or whatever the supplements you are talking about, okay, whatever thing you take, okay, so B12 there is problem in the absorption, whatever the scenario। पिछले स्लाइड में अपन ने क्या देखा था कि एब्जॉर्ब ही नहीं हो रहा था, तो आपसे ओरली दे दो तो एब्जॉर्ब होगा नहीं, so that is, it is injected intramuscular, okay, that has to be given in an injectable form which directly reaches. If you give folic acid, because both the deficiency results into megaloblastic type of anemia, but if due to the absence, congenital absence of intrinsic factor, it is pernicious anemia or Addisonian anemia, okay, but folic acid की deficiency B12 की है, folic acid का supplement दे दिया आपने, okay, ठीक है, so folic acid supplement that will improve the picture of this RBC, okay, but it is not going to improve whatever the damage has been taken place in the nerve. So that damage has to be compensated only by the B12. So although the macrocytic anemia due to vitamin B12 deficiency may respond to folate therapy, you are giving folic acid supplement, okay, so that can be corrected, but neurological findings will not improve. So vitamin B12 also helps in nerve, their properties, their function. तो अगर उसकी डेफिशिएंसी हो रही है तो जो न्यूरोलॉजिकल डैमेज हो गया है उसको फोलेट थेरेपी सब कंपनसेट नहीं करती. ठीक है, इस लाइन को इसलिए समझाया मैंने कि आपको सप्लीमेंट देना है विटामिन B12 का, so it's given only in an injectable form. If it is given in orally, it will not be able to be getting absorbed. Absorption is finally when it reaches to the blood. GI में पढ़ेंगे अपन की 4 stages है, for finally digestion and absorption. So absorption is when the component into the final form reaches into the blood or enters into the circulatory system. So folate therapy may improve the picture of blood, but it will not improve the picture of neurological system. Okay, neurological defects may be permanent if not treated early. Clinical features level will be very low. Clinical symptom features क्या होंगे? Vitamin B12 level will be very low. तो ये आपका जो प्रॉब्लम बेस्ड आता है ना क्वेश्चन, उसमें बहुत छोटी सी लाइन लिखी हुई होगी, विटामिन B12 लेवल वेरी लो. ओके, सो दिस single bullet or the point which is given in your PPT comes as an important point in your question. So you have to correlate it. Okay. Folic acid deficiency, again it causes megaloblastic type of anemia that are large and fewer in numbers. Okay, folic acid requires for formation and maturation, causes a poor dietary intake. So again the emphasis will be given on history or the socio-economic status of the patient. Yeah, the socio-economic status of the patient. Important line is poor dietary intake. Malabsorption syndrome. The dietary supplements are proper, but still it is not being getting reabsorbed. Drugs that inhibit absorption and alcohol abuse. For erythropoiesis, certain factors, hormones are there which will stimulate or increase the erythropoiesis, and certain hormones or factors are there which will inhibit the erythropoiesis. Okay, so one of the factor is alcohol abuse, drugs that inhibit absorption. Here, that will result into megaloblastic type of anemia. The clinical picture will be the folate level will be low. Okay, folic acid level will be low. Aplastic anemia is decreased RBC production in bone marrow due to chemical, drugs or radiation exposure. A means absence, aplastic anemia. So decreased RBC production in bone marrow. So you have to have a bone marrow examination. That will help you to diagnose this particular type of anemia. Okay, and this non-functioning of bone marrow, the causes may be due to chemicals, drugs, exposure, radiation exposure, X-ray exposure. Okay, and these salts. Diagnosis can be confirmed by bone marrow examination. So in problem based question, if a line comes that the patient has gone for bone marrow examination or the bone marrow examination shows this type of picture. Okay, RBCs are normocytic and normochromic. Iron deficiency anemia. कितना टाइम हो गया बच्चों? बस देखो कितनी आवाजें आई हैं. अभी तक ऐसे बैठे हुए थे जैसे पता नहीं क्या हो रहा है. Okay, just this iron deficiency anemia. Okay, most common cause of anemia in developing countries. Okay, inadequate dietary intake, increased blood loss, internal bleeding from GIT, menstrual loss, demand increases during infancy, childhood and pregnancy and lactation, decreased absorption may be due to gastrectomy. तो गैस्ट्रेक्टमी हमारे पहले कहाँ आ रहा था? मेगैलोब्लास्टिक में आ रहा था. इसमें गैस्ट्रेक्टमी आ रहा है तो पिक्चर कैसी रहेगी आपकी सेल्स की? नॉर्मोसाइटिक एंड हाइपोक्रोमिक। इसलिए मॉर्फोलॉजिकल क्लासिफिकेशन को पैरेलल माइंड में सेट करना पड़ेगा ताकि अपन उसके डिफरेंशियल डायग्नोसिस पे पहुंच सके कि हम क्या चीज डायग्नोस करना चाहते हैं। क्लियर? Achlorohydria, that is lack of gastric acid secretion, again that will create a problem. +2 will not be +3 will not get converted in +2, which will not be able for hemoglobin synthesis of formation or malabsorption diseases. If there is problem in iron uptake, there will be problem in the hemoglobin synthesis. Hemoglobin concentration will be low. If it is low hemoglobin concentration, the cell will be hypochromic. Okay. Daily requirement in case of a person, male person, okay, it is 5 to 10. जितना डेली रिक्वायरमेंट है उसका केवल 10% is getting utilized. So this is the requirement. Out of this, only 10% will be getting utilized for hemoglobin synthesis. Okay. Normal in an adult female it is 20, but during pregnancy, lactation, the requirement increases just the double. Clear? Clinical manifestation, second most common. Okay, the tongue becomes inflamed, reddish in appearance. Okay, glossitis, sores are seen in the mouth or the oral cavity, weakness and fatigue, headache, irritability, loss of concentration, nails become dry, soft, spoon-shaped, difficulty in swallowing, and most common is paleness. So what are the special symptoms of the iron deficiency anemia is emphasis given on the tongue or the oral cavity. Clear? So for particular diagnosis, you have to look the whole scenario, all the clinical terms. Okay, what are the manifestation, test which has been done, उसकी क्या हिस्ट्री है, तो उसको एम्फेसाइज करके उसको टेबुलेट करके आपको फाइनल कंक्लूजन पे आ। ओके, कॉजेज ऑफ iron deficiency anemia. Okay, so we'll complete this in the next class.